You're listening to the Exam Room's special 4-part series with Care Manager and RN Pamela Knowlton. Over the past 3 episodes, Pamela has challenged us to rethink what quality healthcare really means. We've explored why meaningful relationships improve patient outcomes, why prevention begins long before patients become high risk, and how burnout, staffing shortages, and emerging technologies are reshaping the healthcare experience for both providers and patients. In this final episode, we turn our attention to solutions. Together, we'll discuss practical ways to bridge the communication gap between clinicians and patients, strengthen therapeutic relationships, and build a healthcare system that never loses sight of the people it serves.
Patients often say that they leave the exam room and they're kind of shaking their head like, what happened? I don't really understand. I went, when my provider was talking to me. And then I walked out and I was like, what? I have so many questions. And
Mhm.
I think a lot of times as patients too, we feel that the provider is like, "Gotta go, gotta go, gotta go." Like, like, I don't have much time to be in here with you, so let's get down to brass tacks and say what we need to say and then get on with it. So, they're leaving the exam room with questions unanswered. They're not comprehending what we're saying to them in the exam room. We have the fight or flight response that is on top of that. Like, I'm worried I'm gonna get what diagnosis am I going to get? What's going on with me? And then when I hear it, I can't hear anything else, right? So we have all of those things impacting our patients when they're in the exam room. And want to talk about in this last segment what bridging that gap could look like. We've talked about time pressure, burnout, increasing workloads, but this fact remains that relationship building is this key component. So we know there's a gap between clinicians and patients. What can we do to bridge that divide?
In a sense, it would be like a case manager triage nurse, sort of like a hybrid almost. In case management, I would know when my patients were going to be having a doctor's appointment. And the conversation would be had, hey, before you go, you and I have talked about a couple things. You've already got questions. Write them down.
Hmm.
Because even I write down my questions because I might be a care provider, but when I walk in that office, I'm a patient and that crap goes right out of my head.
Exactly.
And
Exactly.
and it was the population that I was working with where I could say that and they knew what I was talking about. You could try to meet them where they are. That middle person, that human person that is saying, I get it. You're not alone. And maybe that's where it gives the provider the ability to say, oh, you have that question. It turns into more of a team effort. It is something that is not just, oh, the provider's giving me instructions, he's telling me, he's using words I don't understand. That's where that case manager comes back in and says and calls. And again, relationship, how do you bridge that? You're the middle person.
Yeah.
You be in the middle because there is no middle right now. It's that provider trying to get through those metrics and make sure that they clicked all those boxes because that's what they've been told they have to do. And the patients don't know where to go. They
Mhm.
don't know who to ask because, well, I asked him and he said something and I don't even understand what he said. Well, if you have a person who can explain that to you on the level that you are at, how much better could that be? Where does that cost fit in?
Mhm. That makes me think of, here at BB Care, but mostly on the ABC side, which is our Medicare side of line of business, we have an outreach person and they will reach out to our beneficiaries. And, we did a segment on outreach too, which I think was really insightful. But one of the things that she said was, I might have to talk to a patient for 2 hours And she's fantastic at this. I think this is a prime example of finding somebody who's a right fit for this, because not everybody is a right fit for talking to John for 2 hours about the squirrels and, the dog, before you kind of get into like, what barriers to care do you have?
Mhm.
How are you feeling? Are there things you don't understand? Let us connect you with resources that you need, whatever. Building that relationship takes time, and it also takes a certain type of person, I think, to fill that role. Not every We would be remiss to think that any person can just be stuck in that role, that relationship building role, because I think there's a knack to it.
I absolutely agree. Previously, I was a social worker. Social workers aren't made, they're born.
Mm,
And it's kind of the same thing. Either those relationships, the building of those relationships is just kind of part of your personality, your makeup, and it's not good grammar, but the ability to meet people where they're at,
mhm,
to see that person for who they are, and to accept that, and to be able to reach it, because everybody reacts differently, and you have to be able to be a chameleon, kind of. I guess
mm.
is the best way that I can put it, because we're not all the same. It's not one size fits all. It's not, I can talk to John because he lives in the city, or I can talk to Dave because he's out in the country and I can talk to him about gardens. The ability to meet people where they're at, it's part of that personality. It's not, I mean, you can teach people certain things, but you can't teach that innate ability to communicate to people where on their level.
Absolutely. And let's be fair, we're not really teaching that in medical school either.
No,
Right? That's clearly not the role of the clinician anyways.
right.
Like, we had one of our providers on the podcast, and he felt very strongly about, my role is to diagnose and treat. That's my role.
Mhm.
There's other people that their roles are different from mine, whether that's education or addressing social determinants of health, or medication reconciliation, whatever that is. That's why we talk about an integrated approach to
Mhm.
healthcare. Like, my job as the clinician, diagnose and treat, and then Susie's job is to outreach and connect, because that's her jam. And, somebody else, whatever. So I do think it's really important. That saying, it takes a village, it comes to mind, because
Mhm.
caring for a person's life, it's not what just one person's job. It can't be just one person's job.
Agree.
As we kind of wrap up, I just have one more question for you, and that is, if FQHC healthcare leaders were sitting in front of you right now, what would you want them to understand?
Quality matters.
Mm,
That we need to be able to encourage building therapeutic relationships with patients. And that's not to say that we're going to stay in their lives for 42 years. That's to say that there is an end in sight, and it's when that patient can deal with whatever they have to deal with their health issues. That, healthcare is not a subsidiary of the insurance companies.
mm,
I think that is huge. And we've allowed the care of humans to become big business. And that's not who I am. And there are a lot of people who think that. And again, we have turned into a sick care system, not a health care system. People matter. Just
mm,
people matter. And that leadership has family. Everybody should have the ability to access the education and have their needs met. People matter, and quality matters. It's not quantity, because those people who have the quality care are the ones that don't wind up using those dollars for inpatient, for end stage, for all of the things that matter to the people who are counting those beans, as opposed to caring for the people.
What is one thing that gives you hope?
People like you doing the podcast. Seriously, kind of knowing that what I'm saying, you didn't go running into the woods as I was saying it. That maybe I'm not the only one who thinks this way, and maybe there is still a place for me somewhere in healthcare to be able to do what's right.
Thank you so much. Having people like you on our podcast is what gives me hope as well. Pamela, thank you so much for this honest and thoughtful conversation. It has been a pleasure.
It certainly has. Thank you for having me on.
Throughout this 4-part conversation, we've explored what happens when healthcare places relationships at the center of care. We've discussed the importance of trust, prevention, communication, clinician well-being, and thoughtfully integrating technology while preserving the human connection that patients need most. If there's one message to take away from this series, it's this: every quality measure represents a person. Every outcome begins with a relationship, and meaningful healthcare starts by meeting people where they are. On behalf of Dr. Rhiannon Winsor, Pamela Knowlton, and all of us at the Exam Room, thank you for listening. We hope these conversations inspire new ideas, meaningful discussions, and a continued commitment to building a healthier future, one relationship at a time.